IKP Knowledge Park, who is going to moderate this session. Can we have a huge round of applause for now invite on stage Mr. Mudit, Turtle Shell Technologies Private Limited. Very warm welcome. May I now invite on stage Dr. PBN Choudary, Medical Director, Clinical Protocol, CallHealth Services Private Limited. Dr. GVS Murthy, Director, IIPH, to please join the panel discussion, and the topic would be Synergistic Approach in Indian Digital Healthcare, Accelerating Indian Digital Healthcare. A very warm welcome to all the panelists on the dais. May I now invite Dr. Ambuj Chaturvedi, Senior Vice President, IKP Knowledge Park, to please moderate the session.
Thank you. So this is a discussion on achieving synergies within the digital healthcare landscape. I have 4 speakers with me, 4 panelists, all of them experts from different areas, different zones. I had the privilege to talk to them, some of them, before the session. And while I started talking to each of them, our discussions on the telephone itself was so rich. I thought maybe the stage should light up today. And some of you had the chance to listen to me earlier. I was talking about the digital healthcare strategy from a global perspective. But while we talk about synergies in this session, we're going to stick to the Indian landscape. And so here the first question then I have is for Dr. Choudary. What are some of the unique differences between the Indian versus the global landscape with respect to digital healthcare? So when we talk about digital healthcare from a global standpoint, you talk about all the technologies, key technologies coming in, robotics, etc. But when you're talking about the Indian landscape, what does digital healthcare look for from the Indian side? Mike.
Am I audible? Yeah. First of all, thank you for the organizers for having me here. I think when we are talking about digital healthcare, right, there's something called as before Corona and after Corona. Now I think the entire conversation has changed. And if you're talking about the digital ecosystem, right, when most of the time when we say health, we look to the West, and traditional medicine we look to the East. When we say the West, right, now you were seeing in the media as well as the news, we are definitely in a better position when it comes to COVID. So I have 3 points which come to my mind as soon as you ask the question. But then before that, let me just make my point why I came to that particular conclusion. When you're talking about healthcare and healthcare ecosystem, right, healthcare can be divided into 3 segments, right? You got a payer or the insurance company, provider, a doctor or hospital, and a member or a person who's consuming. So coming from the insurance sector definitely has penetrated much more than what it was earlier, but definitely it needs to go a long way. Coming to the providers I'm restricting to hospitals and the clinicians. More or less, thanks to COVID, now there is acceptance of telemedicine. Me being a doctor who is into IT from almost 2 decades, I see the challenges how the healthcare service delivery or healthcare IT systems try to convince the doctor. But thanks to COVID, that has been accepted. And when you're talking about the healthcare from the hospital perspective, then again you've got 2 sectors, right? You've got government sector and the private sector. So the adaptation of technology in private sector is definitely comparatively high when you compare to government sector, but then government sector they're also coming up. One more major change which we have noticed is, earlier when you're looking into the digital healthcare acceptance or the technology implementation in the hospitals, it is more on the administration side, not on the patient side. Now it has become more of consumer centric. Now third sector, what we're talking about, the consumer or the patient. Now when we provide care, we call them patients, but now when you're talking from a technology point of view, they become your consumers. So when you're talking from the consumer's point of view, right, consumers have become smart. In fact, they're much more smarter than most of the people we tend to. And we think that the metro folks are much more smarter, but the other way around, the people from village till metro, all of them have access to the information that is available. They demand the kind of service what they want. They want transparency. quality and cost. So the reason why I gave this small background is the three unique features which I say from the Indian healthcare ecosystem. If it was earlier COVID, we can go for a lot of things. You can just Google, you'll find a lot of things. But then what I see is one is the affordability, accessibility, and availability of systems. These 3 points, which are the fundamentals of any healthcare going down the line, especially the coming decade. I see that India is going to beat hands down to everyone. For example, right, earlier a discussion, we were having a conversation on UPI. Now, right, what we are going to give to the world. Now, COVID, a lot of other countries are getting in. So from my point, accessibility, affordability, and availability. These are things which are common throughout the world. And everyone say, "Ha, yaar, ye to theek hi hai, ye to sabhi kar rahe hain." But the point is, this is what is going to be very unique because of the acceptance of the technology. The best example would be the banking industry, what the example was given, right? So when we go to check for let us say a decade back, aapko ek coin dete the. I'm not very sure a lot of people understand the banking system, how it was. So I think the acceptance of digital healthcare has definitely gone up. So those are my 3 unique points. Thank you.
Interesting. And you're actually right. You know, when we start looking at consumers. In fact, that was a tough call for me as well. So when I moved from surgery to into the corporate world, the HR induction that happens for Fortis hospitals, they said, the patient is a customer. This is our customer. I couldn't digest it. Today I give my talks on it. So the change happens. For some, it happens a little late. So we've spoken about the Indian landscape. I would now like to understand more about the landscape from a state standpoint, from Telangana standpoint, which is where my question is directed to Mudit sir. Now, Telangana holds, according to a lot of stats, if you see, it holds a star status when it comes in terms of life sciences. I mean, we are probably not wrong if we say that we are one of the key hubs for pharma production. And so therefore, life sciences is one big area where Telangana holds a star status. Digital healthcare, what kind of vision should a state like Telangana have? And I'm talking of the digital healthcare reaching out to the masses. What would be your thoughts, sir?
Thank you very much for raising that particular issue, because in the debate that the two of you were having, we were going in the direction of the customer or the client or whatever we call it. The bigger use now, especially once you have linking up with the Aadhaar, is the fact that you have the opportunity to have a linked database, which Telangana attempted in 2015 when they had a survey right across Telangana, where health was also one of the components. Unfortunately, there was no follow-on to that, in the sense that no analysis of that data, health data, was done. But now the government is looking at having a complete digitized health survey for the entire 38 million population of the state, and to then look at issues related to prevalence of certain conditions. It will help the insurance industry to look at what is the profile here. But more importantly, for somebody who's in the public health space, it helps you to plan the priorities in terms of what you need to look at the population needs. The problems are there in terms of portability of data. So anything that is built around the population needs, who do you share it with? How do you share it with? What are issues related to confidentiality? We've done 2 small projects on diabetic retinopathy and retinopathy of prematurity, working across 10 states. One of the big things that came up was people were not willing, the clinicians were not willing to share the data with the government, and the government was not sharing or providing the feedback to the states. So there needs to be more transparency. If you can share money, I'm sure you can share data related to health problems without any issue. That has to be put on the plate and has to be discussed. Every state would need to have a database which will help in planning, for insurance purposes, for state to prioritize on where they need to go. Certain conditions which go below the market, like say hearing impairment, cerebral palsy. These are not generally recognized when you look at the insurance sector or the planners. Now here is an opportunity that disability also gets an important place along with conditions like cardiovascular morbidity which leads to deaths. So the state has an opportunity to now look at what we look at the minor conditions but have a major impact because people have to live with that problem for a much longer time. You get a myocardial infarction, if you're lucky you survive, if you're unlucky you die immediately. So the cost is only at that point in time. But for those conditions like say diabetes or conditions like cerebral palsy, it's a lifelong expenditure that one has to look at, both from the individual family side as well as the government side. So to be able to prioritize when you do not have money growing on the trees, digital health from a government perspective will also be very helpful. So there are a number of areas. You also need disaggregated data. We are talking about gender equity. Are women getting the same amount of services as men? Now that only a statewide interconnected database connection network database can give you. Are people who are underprivileged able to access services in the same manner? And is their satisfaction of the same degree? Once again, the state needs to know that when they have to implement programs. So in all of these, the state has to have this focus that people in the forefront, and how do we serve those people as the facilitator. The government should remain a facilitator. It should not be the implementer for a lot of things, especially for healthcare. But to be the facilitator, they would need to provide this template for action. That would be my...
That is interesting. In fact, one point which really struck me when you said was, and I made a mental note of it, is that, healthcare quality cannot go, in fact, it has to lead to social equity. The entire concept of marginalized groups is something that is working there. So maybe we'll have a discussion after this at a later time, but I need to, this is an interesting perspective. It connects healthcare to the larger social fabric, so to say. Now, while we are talking about public health, infrastructure, and you talked about the entire piece around digitization and the role of data. My question would now be to Dr. Ranga Reddy, and let's just dive a little deeply. Let's do a deeper dive into the public health infrastructure and data. Now, data has already been alluded. What about infrastructure? What kind of challenges or constraints do you see? What kind of optimistic situations or opportunities do you see within the public health space vis-a-vis digital healthcare?
Well, first of all, I'm an eternal optimist. So, despite of what is happening with COVID-19, despite of the infrastructure gaps, what we have seen during COVID especially, but I think, the COVID has brought that much needed attention to public health from all the corners. Either it is private sector, or it is the public sector, or it is the common man. Now, I think everybody realized the need and urgency which is with which we need to act on certain areas. Going ahead, probably it is inconceivable for us to think of the healthcare what we have imagined prior to COVID, right? COVID, from the sense of digitization or the digital health, I think it has completely accelerated. What we would not have imagined pre-COVID, today they are happening automatically. Without sometimes even without regulators not. First they are happening, and then regulator is coming into the picture and trying to see how to put a framework. I think that is something good which is happening. As far as infrastructure is concerned, I may be actually taking a view which is contrary to most of the people in healthcare, especially the private healthcare. we don't need to build the huge settings going ahead, especially the, big ticket hospitals, there's something like 1,000 beds, the megalomaniac kind of projects, probably they are not required. I think, we need a decentralization, not the centralization. And of course, people like Professor Murthy, Professor Srinath Reddy, who are the luminaries in the public health, they keep actually urging that we need to move into universal healthcare as quickly as possible. That will not be possible, if we are not going to strengthen the primary healthcare, the wellness of the people. I think, the government should be more and more focusing on universal healthcare, which is based on a very rugged system at primary level, right? And leaving probably the tertiary care to the private sector, which is very efficient, because it requires, very different kind of inputs in order to make it happen. So, just to sum it up, my thinking is that going ahead, we need a lot of decentralization. Government should play more of a brother who is going to facilitate the job of the existing stakeholders rather than trying to come in and elbow the others. Number three, the digital health, which has happened and taken a very rapid jump. The government should finally come out with a framework to enable it going in a much more rapid fashion, because we have a habit of starting something, and when the urgency is gone, we tend to forget. But I think COVID should not be forgotten. Whatever good we have actually achieved, that should be taken forward. And the government definitely has a big role to play there in terms of putting the framework. With that, I am sure we are going to improve overall healthcare system, overall wellness of the public. Because more than the health, I think it is the wellness which had to come prominently on the agenda of the nation and the world. Thank you.
Great. So I actually gathered two specific points. The first was, you're delving a little deep into the infrastructure, public health infrastructure. At the same time, talking about the roles and responsibilities. And government, I'm getting some very clear vibes. Should not be the implementer, but should be a facilitator. The second piece, of course, was you've now shifted the focus towards, not shifted, you have broadened the focus to include wellness, which brings me to Mudit. The moment I look at wellness, I look at the entire piece of remote monitoring, and I've had the privilege of watching his journey over the last 4 or 5 years that we've known each other, and I've steadily seen him. So Mudit, you're here. You're hearing from the veterans. You're hearing from the experts on what the expectations are from innovators out there. What will it take for you to deliver on those expectations?
Yeah. Am I audible? Yeah. So it's okay. So so in fact, even the talk before this as well, right? So hearing the two veterans before me, sorry, three, before me and Dr. Ambuj and also Dr. Sharad as well, right? So the challenge that we have, right, to deliver in India is not just we have to serve to 1.3 billion people, right? But to do that at almost 1/5 the cost of what world has done, right? And even lower than that. And only then we are going to reach that kind of a scale. Now doing that, one thing which is going to play a very important role, right? Moment we are very manual heavy, that cannot be done. Digitization needs to be done. And that's what we have done in fintech and everything which has happened so far. So digital health coming in public sector is going to be the key to serve and ensure that quality care is given to everyone. Decentralization, as Dr. Ranga also said, very key to it. Now I'll just tell you about what I don't know, as you mentioned, just started on this journey. I'll just tell you about our mini experiment that we did last 1 year and how to do that, and probably that is what we can do at much higher scale, right? Maybe. one solution to that. So apart from Dozee, right? So one thing that I am really proud of, what we launched about 6 months back, that's called Million ICU. We called it Million ICU because in India, in public health, we have 1 million beds. And our vision is that, in every bed should be a connected bed. And the care which is given in that should be nothing less than an ICU care. It doesn't mean that, you hook up every patient to wires, electrodes and things like that. And that's where, our sensing technology comes into picture that converts any bed into a connected bed without touching the person as well. So it's entirely contactless, no intrusion to the patient, and yet it is connected. So doctors can remotely monitor, administrators can remotely access all the data. And you can imagine the entire state's data and all of that, getting in one repository so that better decisions can be taken. It was life-saving in nature. So right now already we are in more than 40 public hospitals across India, across 10 states. We are not that much in Telangana. We'd like to change that working with sir. But we are very strong in Karnataka, Maharashtra, Sikkim, Delhi, and all of these places. But we converted close to about 2,400 beds into connected beds. Now the power of that was that, it saved very hard. We are in fact working with both public as well as private settings. In fact, from here I'm actually going to Mysore, and there we are, rolling out another hospital, that we entirely digitized as well. Right? It is a public hospital. And the impact that it delivers is just immense, right? And this is just one very humble innovation. The another thing which is required is more of such innovations coming in, and that's where, a lot of work that has to be required, and which is done well from BIRAC, DST, from IKPs and all of them, right? So one of the supportees are us, but it is required in much more way, as in even today as well, we are importing 85% of the medical devices. I think when we are talking Atmanirbhar, right, this is the number that we should be keep on tracking every day, right? So it needs to be come down to not more than 10%, right? And that's only when it is going to be possible.
No, you actually got me to dovetail straight into the next question for Professor Murthy. So Professor Murthy, we've kind of heard Mudit and his plea support the entire piece. Now, let me draft my question in a politically correct manner. So, and we only have 11 minutes more, so maybe we'll make the answers quick. So here's the thing. Are there any initiatives from the government side where innovators with relatively less established legacies have a chance to play?
Well, I'm not on the government panel, so I would not be able to comment exactly on that, but just to look at the way the environment within the government is, especially in this state, with the introduction of the hubs, I think that has been a great opportunity to scale up people who are coming up with ideation. We've not actually gone into a complete field validation. So that opportunity does exist. But I know that a lot of other governments are also doing it, including the government of India. There are also, parallel templates which have been developed. So the World Economic Forum has set up an initiative called the 4IR, which is looking at the internet making the revolution in relation to healthcare. And they've identified 23 domains of healthcare. And the lead for that is Mr. J. Satyanarayana, who is responsible for the Aadhaar, the final stages. So he moved from there to set this up. And they are working with governments, with institutions like IIIT, and trying to identify. I've just been with them on the cancer journey, and that was the first domain that WF looked at. And we were able to identify about 25 to 26 people with ideation where there is an opportunity for validation. And the government should support that validation. It's not in terms of delivery, and that's why I come back to that again. The facilitator's role is the more important role for the government. So state governments should identify, and they could have a screening group with people like you who could screen, okay, this looks promising, allow them to validate, work with the public hospitals to see the validation has scientific rigor, and then allow the commercialization or rolling out of that. But I don't think the government should be investing completely on the implementation side of the digital health mission, just for the simple reason that Dr. Ranga Reddy talked about infrastructure. Yes, you can digitize a lot of that infrastructure need, but you ultimately need a person on the ground to deliver the final service. And for that, already the resources are constrained. And therefore, the best thing for the government, the space for the government, should be the role of the big brother, like he called it, the facilitator, giving a level playing field for different ideas to come forward, be validated, and then be released. One thing that I have seen with a lot of cardiac and ophthalmic innovations is that the ideation does not come to fruition because there is no scientifically valid mechanism that they try to utilize. And that's where the government should come. That's my view.
Got it. No, I actually, yeah, so that's again, putting it back, to looking at roles and responsibilities, and I kind of agree with you on that one. While Mudit was talking about COVID, I went back to COVID, and now, so COVID continues to play with us, so it purportedly started with bats, visited us, wreaked havoc for almost a year and a half. And now, the other day I was reading something, and it says it's now found in deer. So it finds new reservoirs. And the moment you start looking at that, you start looking at the One Health piece, which is, you look at animal health, human health, environment health. And so my question to Dr. Ranga Reddy now is there a role for digital health solutions, solutions like surveillance-based platforms to counter, or not just from a disaster preparedness point of view, but to counter and even preempt the emergence of epidemics or pandemics?
Absolutely. I think you have touched upon a topic which is very dear to my heart and my passion. In fact, if you look at the inaugural day, almost 50% of the time was spent on how do we move towards One Health. I think, because of the paucity of time, I would not, answer very deeply, but very superficially. Number one, One Health cannot move forward without digital health and digital technologies. There are various levels where the digital or the technologies are going to play a very vital role. It starts from the basic thing, that is surveillance. Today, which is haphazard, not only in India but worldwide, right? So the digital tools are going to accelerate the whole thing, and both the collection, dissemination, and processing, and probably even expert validation of the data can happen through validation, which also probably partly AI, ML, all those technologies can also be included, which will make the whole system robust and probably the real time. That is one. Second area where the digital health is going to play a very vital role, to my mind, is the point of care diagnostics or the point of care testing, right? We have seen during the COVID how difficult it is to scale up the manufacturing and also to take, actually, even if we have all those diagnostic kits, to make them available and to find human resources to really use them was a big problem. So how do we bring in digital health in order to, or the digital technologies, in order to ensure that diagnostics are going to happen at the client place, like what you said. We won't call them as patients, we'll call them as the citizens or the clients who are going to get the diagnostics done. The third area, as we know, One Health requires a multidisciplinary approach. Today we are working in silos. There is animal health, there is a human health, there is environment, and they probably cannot, all these specialists, they cannot even see each other, right? I'm not saying they hate each other, but only the thing is they don't see each other. So I think, again, the technology can play a very vital role, bringing the, kind of building the platforms where these inter-sectors and multiple disciplines can talk to each other and find common solutions to the common problems of the world, common problems of not only the humans but also the animals and also the environment. So I think there is a big role to play. Details probably who are interested, probably we can offline take it up. Because of the paucity of time, probably I will stop it at that.
Yeah. So we have about 5 minutes left now. I can already smell the aroma of biryani somewhere. So even I need to wrap up the discussions with that. So, but there are two more questions that I have, and I know final two. And Mudit, the question to you is, while Dr. Ranga Reddy was talking about the entire surveillance piece, it just struck me, and so this is an impromptu one. You have a device which is focused on cardiac health, it is focused on individual health. Do you see a potential or an opportunity for this solution to be scaled up to a surveillance level solution? Cardiac solution. So for example, population health, cardiac surveillance.
Absolutely. So over there, I think there were three, as your slide did mention that, right? So there are 3 steps towards it. So prevention, diagnostics, and then management. And intervention is there, but intervention is not something which any monitoring device does, right? So I'm just skipping that. So prevention, yes, we do. So I use it every day. So that is for prevention. That tells me basically what is my stress levels and everything. Is it very popular in that? No, answer is no, right? Because prevention is a hard thing to sell, right? What is easier to sell at times is, especially for something which is new, is management and diagnosis, right? So diagnosis, yes, we are right now even working with AIMS Jodhpur. So we launched a big study with 6 AIMS across India for heart failure, at how we can do early diagnosis of heart failure, because so far you can only do it with likes of 2D Doppler echo and so on. What if every bed had that power that in every heartbeat we could do a heart failure analysis? Similarly, sleep apnea, which are very underdiagnosed problems which are there, not just in India but globally. So that is there. We are working on that. But where we are even stronger is into management. And even if you think about it, management also is a huge population. So 55 million cardiac population in India today, right? And who is managing them? 4,000 cardiologists. How can they do that, right, if they don't have access to the entire data and all that? So I would say the start can be management, and of course, the further pathway can be into diagnosis. It is anyways happening, and also into prevention as well.
Oh, great. So I see some very positive vibes from your side. You would want to look at that solution, but whenever you feel like, I'm just a phone call away. So we'll get you sorted out through the maze. The last question now will be, to someone who I talked just a couple of days back, but I think the way we hit off on the call, it was like, and I view you as, sort of an aggregator of sorts. You have this ability to get multiple points of view and then, put it all across, package it into a solution and deliver it to clients, patients, clients, whichever way you want to take it. And so, my question to you would be, how do you sum up this entire discussion? But how do you wrap up? And I need 2 different perspectives, Doc. One is from a public-private partnership point of view. How do you see them coming together? The other is device and platform integration. How do you see? So how do you see that entire process panning out?
Okay. To go with the first question about PP, public-private model. One thing for sure where I see a lot of value is on the step-down care. That is something where, in fact, the companies which are come and they open up center for step-down care, but then it has to be at a larger scale. Government is very good at a volume, and private sector is very good at technology and implementation. So there should be some kind of shake hand, and then there should be a model that needs to be worked out where there is step-down care. For example, a person who has had a stroke, right? He gets to a government hospital, the immediate, or he had a quadriplegia or hemiplegia. What is going to happen? Right? That bed is taken for a longer time. So the emergent requirement is met and the treatment is given. He is sent home. Once he goes back home, then unfortunately, if he comes from a certain area where the medical health services are not available, then the correct person is not providing the correct service. You find quacks coming in and all the new kind of stuff, and he will be hemorrhaging money. So one of the public-private model would be on step-down care, and the other would be, as we've been talking earlier, strengthening of the primary healthcare system. So actually, there are certain models which have been going on where government and private parties have worked together to have a digital primary healthcare center. So that is one area where I'm saying. Coming to an aggregator point of view, right? For CallHealth, for example, my company is an aggregator. So down the line, I see there are a lot of companies which are going to come up as aggregator of services. So maybe when I say aggregator of services, maybe Dozee will become my partner. So he will be providing me a cardiac solution. So I might be having company B who will be providing me diabetes management, continuous glucose monitoring. One more company which is doing something on sleep study. So what I will become is I'll be a point of entry for multiple services or solutions. So I see down the line there are multiple aggregators who are going to come into field and multiple startups. And one more thing is, right, I'm seeing so many startups which are coming in and startups are focusing on one individual problem. You might not take the entire ecosystem, right? If you're talking about human being, right? Just pulse oximeters are very important, right? Who thought that 94% has a huge impact until COVID turned up? 94 chalta hai, theek hai, everything is fine. It goes to 93, you start panicking. That 94 number, right? So when you're talking about the machines coming in, the cost is a major hindrance factor. So maybe when you come to aggregator and let us talk about, for example, if you're talking about continuous glucose monitoring, let us say I have a let us say Dozee does a disease management program for diabetes and they have continuous glucose monitoring. So they have to come with a package where the cost is effective. I should subscribe to the cost and the burden should not be there. Then it's going to be effective. So one in the public-private partnership, step-down care and digitization of primary health care so that the grassroots level people are healthy as well as wellness being a component of it. The second thing would be the multiple players coming to an aggregator and cost being a major fact which is controlled. Thank you.
Great. Wonderful way to sum up. And so, in summary, in fact, Dr. Ranga Reddy, you now need to see, there is matchmaking happening right now on the stage as we speak. So, but to sum up 3 points. Point number 1, digital healthcare, digital technologies are here to stay. That's point number 1. Point number 2 is, I see after this discussion an interesting role for digital healthcare in getting the public and private players onto certain convergent goals. And the third piece that I see is it's all happening in the ecosystem. We can see from multiple standpoints and multiple stakeholders, everyone seems ready. So in that popular Bollywood movie Sholay, as they say, Loha garam hai, we hatoda maar do, whatever. I think that's what it is. The time is now, and with this positive note, I will conclude the discussion out here. Thank you so much, everyone, for being here, and thank you so much for patiently listening to the entire thing.